Men have been getting FDA-approved testosterone for nearly a century, and all they need to do is do one simple blood test and they're good to go. Meanwhile, women get brain fog, low libido, zapped energy, and their doctor telling them their labs are completely normal and that they're just fine. If you've ever wondered about this double standard, stay with me. I'm diving into testosterone, the hormone that somehow isn't readily available to women, even though it may be exactly what you need to feel alive again with your libido, with your energy, and with your passion. I'm Dr. Janet Williams, a board-certified obstetrician-gynecologist, intimate health coach, and hypnotherapist. And I help women over 40 navigate perimenopause and menopause, things like hot flashes, low libido, poor sleep, so that they can have more pleasure, more passion, and more peace in their lives. In this video, I am diving in. We're gonna dive all the way into testosterone and testosterone for women in a way that you probably have not heard before. In this video, I'm going to talk about what testosterone actually does for women, how that changes in menopause, and what the science actually tells us about testosterone as it relates to libido as well as brain health. Before we jump in, make sure that you subscribe to this channel and share this video with a friend that you know needs this information. When you subscribe to this channel, it helps other women to find this information that's very helpful and can make a change in their lives. So let's start with the basics. Testosterone is not a male hormone. It is actually a human hormone. So both men and women have testosterone. The difference is in the amounts of testosterone. So not whether it's present or absent, but the amounts that are in either gender. In women, testosterone is made mainly by the ovaries, partly by the adrenal glands, and then additional conversion of testosterone occurs in the peripheral tissues. And one thing that people don't realize is that women actually have 4 times the amount of testosterone floating around in their bodies as they do compared to estrogen. So there's actually a lot of testosterone in our bodies. So for years, we've thought that, men have testosterone, women have estrogen, but we both actually have both. So testosterone is not a foreign thing. It is something that's in our body, and it's been there since puberty. So what does it do? It does a lot of things. It helps with libido. It helps with mood and motivation, energy, our muscle strength, bone health, brain functioning, and dopamine signaling. Blood flow, so blood flow to important areas like our genitals, to the clitoris. There's important blood flow that testosterone is really involved with. Testosterone is also involved with the mitochondrial function. So the mitochondria are the powerhouse of the cell. Mitochondrial function, or sort of like the energy powerhouses of our cells, like little energy factories of our cells. And so testosterone is very involved with the mitochondria. And an overall sense of well-being and vitality. Testosterone is linked to all of these things. Now, in perimenopause and menopause, the testosterone and its precursors, the things that are there before testosterone is formed, those are called androgens. So the testosterone and its precursors are called androgens. These androgens decline gradually with age, and they will drop very sharply if the ovaries are removed surgically for whatever reason. So after menopause, the ovaries really have a significant decrease in the amount of hormones that they produce. And so you still have some testosterone and androgen production from the adrenal glands and the peripheral conversion of those hormones, but your baseline is much, much lower once the ovaries stop functioning. And this is a lot lower than when you're in your 20s or 30s. So some of the time, the symptoms that you have from a lower testosterone will be a little bit vague. or you can't necessarily put your finger on it, but things like low energy, low motivation, loss of muscle mass, and it may become harder to lose fat. You might feel blunted or flat with your libido, loss of interest in sex and sexual activities, less spontaneity in your desire, lower arousal or a decrease in your body's response to desire, and a decrease in the intensity of orgasm. We see that a lot of times where women will still have the desire. They might have arousal, but they cannot reach the same level of intensity with their orgasm. And then there's mood changes like feeling irritable, feeling flat, feeling off your game, so to speak. Let's talk a little bit about the evidence-based indications or reasons for using testosterone in women. So as far as the global consensus guidelines go, the only evidence-based indication for women at this time for systemic testosterone is the hypoactive sexual desire disorder in postmenopausal women. And this is a persistent or recurrent deficiency or absence of sexual fantasies and desire for sexual activity. And it comes along with a marked distress. So this is something that's really bothering you and interfering with your interpersonal relationships, so interpersonal difficulty. So this is not like every once in a while you don't feel like doing it, or you're tired tonight, for example. It's more like you don't ever think about sex. You could go, months or years without sex. It is distressing to you, or wanting or missing that part of you that was intimate and enjoyed intimacy before. So before you can come to that diagnosis, we want to look at all of the other areas as well. So we want to make sure that all of the biological factors are squared away, hormone related things, pain, medications, sleep, and other medical conditions that may be contributing. Also psychological factors, so depression, anxiety, trauma, if we addressed all of those things. And then the social cultural factors like shame, religious messaging or cultural taboos that may be contributing or pulling away from your intimacy. And then interpersonal factors. So like, is the relationship crap? Are you in a good relationship? Are you having conflict in the relationship? Is there resentment? Is there safety in the relationship? So all of these factors play a role in libido. And so before we can make that diagnosis of hyposexual desire disorder, we have to take a look at all of these factors as well to make sure that none of those are interfering with the healthy libido. So this is persistent, that's causing distress and causing problems in interpersonal relationships. So once that diagnosis is in place, what the data shows us is that transdermal testosterone in the premenopausal physiologic range, so meaning in the hormonal level that is normal for someone, normal for a woman in premenopause before they get through menopause. When we bring those testosterone levels up to a normal physiologic range for a premenopausal woman, sexual desire or libido improves. There's a lot less distress or like anxiety around any changes in libido. We see increased frequency of sexual events that are enjoyable. We see improved arousal or your body's response to desire. We see improved orgasm, enhanced pleasure and responsiveness, and an improved sexual image and confidence in oneself. Now, we know that testosterone has a role in the nerve tissue in our brains. And both estrogen and testosterone are deeply involved with how the brain ages. And the timing of hormonal loss really can affect the way the brain ages. While we need more research in this area, it may be something to consider when we're talking about hormone therapy for menopause symptoms in addressing not only things like hot flashes and sleep problems, but also the potential for prevention of poor brain aging and things like dementia. That is it for this video. I will be talking more about testosterone in future videos regarding the dosing and who's a good candidate and how you can go about getting testosterone for yourself safely, and we'll talk about that in some future videos. Let me know in the comments, would you try testosterone therapy? Is it something that you're interested in? Let me know. Thanks so much for watching, and I will see you soon.